Patient marks she is a type 1 diabetic and takes medicine daily to control this condition.
Thank you, Danielle. I'll take you back in just a moment.
Okay, thank you.
Note that the patient is beginning to show signs of weakness.
You can have a seat right here, and I'll take your purse.
The hygienist is quickly overlooking her medical history but bypasses the box that is marked type 1 diabetic.
Okay, so I noticed that you don't have any severe heart problems, and you just take insulin once a day?
Yes.
Okay. All right, well, we're going to go ahead and get started. I'm going to lean you back, all right?
As the hygienist is about to start treatment, she notices the patient is restless and has profound sweating. Her skin is clammy and cold. The patient is looking around confused and not sure of what's going on.
Do you feel okay, or are you uncomfortable? You seem a little uneasy.
No, I just really want to go.
I did notice, I think you marked that you have type 1 diabetes. Did you eat today?
No, I've been really busy. I forgot to take my insulin this morning. I only had a granola bar for breakfast.
Then the hygienist realizes that the patient is going into hypoglycemic shock.
Okay, well, I think that you need some sugar. So let me go see what we have, and I'll be right back.
Okay.
All right, here's a candy bar. You can just take a bite of this, and then you should be fine.
Okay.
And then take a sip. So, are you feeling better now?
Yeah, I feel much better.
The hygienist is not monitoring the patient's vitals or showing any precaution in making sure that the patient's condition doesn't worsen.
Okay, well, since you're feeling better, we'll go ahead and end your another time. Just make sure you take your insulin, okay?
Okay.
And then I can help you at the front desk.
After a person is suffering from hypoglycemic shock, they should be monitored for at least 30 minutes and not sent home right away just because they were given a small amount of sugar. All the precautions were not shown here.
Hi, my first name's Danielle. I don't know if I can hit 10 o'clock.
Okay, here's some paperwork. Go ahead and fill it out, and then you can bring it back up when you're done.
Okay.
The patient has marked that she is a type 1 diabetic and takes medicine to control her condition daily.
Thank you, and I'll take you back in just a moment.
Okay.
Note the patient is showing signs of weakness and agitation.
All right, Danielle, you can come on back, please. You can have a seat right in here, and I'll take your purse. Thank you. All right, so how are you feeling today?
Really tired.
The hygienist is thoroughly looking through the patient's medical history.
Okay, Danielle, so I noticed that you marked that you're a type 1 diabetic. Did you measure your glucose levels before coming in today?
Yes.
Yes. And what was the value?
I don't remember the exact number, but I'm pretty sure it was normal.
It was normal. Okay. And did you eat today before coming?
Yeah. I had Cheerios.
I'm sorry to hear that, but we'll start your treatment soon. Did you take your insulin today?
Yeah, I always take it.
Okay. And do you have any concerns regarding your teeth, like sensitivity or dry mouth?
I have dry mouth sometimes.
All right. Well, we can go over some ways to help that before you leave.
Okay. Thank you.
Oh. All right. Well, I'm going to lean you back, and we'll get started, and we'll be done very shortly.
Okay.
As the hygienist is about to start treatment, she notices the patient's restlessness and profound sweating. Her skin is clammy and cold. The patient is looking around confused, not sure of what's going on.
Are you okay?
No, I just really want to go home.
The hygienist realizes that the patient is not okay to drive home. She is going into hypoglycemic shock and needs to raise her glucose levels as soon as possible.
Okay, well, I think your blood glucose levels are a little low, so I'm going to go find some sugar to see if we can bring that number up, okay?
Okay.
Stay right there, I'll be right back.
The hygienist rushes to the emergency kit and grabs 20 grams of sugar.
Okay. And go ahead and take a few sips of that. And take a couple bites of this. And then let's take a couple more sips of the orange. Take a couple more sips of the orange juice. Okay. So now I'm going to monitor your blood pressure just to see how everything's going.
The hygienist has secured the patient's airway and will monitor her blood pressure for the next 30 minutes. After the patient intakes the glucose, both the patient and the dental professional should notice a positive response within 10 to 15 minutes.
Alrighty, so are you feeling better? Okay, well, I'm glad you're feeling better. We are going to stop your appointment for today and reschedule for another time when you've had a well-balanced meal and have taken your insulin. And also for future appointments, we're going to keep them a little bit shorter to help ensure that you don't miss any of your medicine dosage or any meals.
Okay.
All right.
The hygienist is going through ways to help the patient know the signs of hypoglycemic shock and what to do if she starts to feel an onset of having low blood sugar.
Okay, well, I can walk you up to the front and we'll go ahead and schedule your next appointment.
If a patient is in hypoglycemic shock and goes unconscious, the hygienist would have grabbed glucagon from the emergency kit and administer 1 milligram subcutaneously or intramuscularly. The hygienist would have notified another staff member to ensure safety and contacted EMS immediately.
All right, well, you're all set. We'll see you next time.
Thank you.
Take care.
Don't look like that.
Okay. I forgot what I wanted.
Just really tired.
Why did that? Here, Alexis.